BackerNation. Back pain care starts here.
Hello, my name is Resio, and I'm founder and CEO of BackerNation. Today, I wanted to share some information about lumbar artificial disc replacement. Now, this is a topic that is very near and dear to my heart. I had a degenerative disc in my lower back, L4-5, which I herniated 4 times over 5 years. I was in pretty bad shape, each day filled with extreme pain and missing out on the things that I love. But disc replacement totally changed my life, and I feel amazing today. I've made it one of my missions to help anyone that I can learn about disc replacement as a potential solution to overcome their back pain. I was able to get some of the most knowledgeable and experienced disc replacement surgeons in the industry to answer questions, provide insights, and share some patient stories. Let's get started. What is lumbar artificial disc replacement?
A lumbar artificial disc replacement is a way of stabilizing a painful segment in the spine after the painful disc has been removed. In the past, we had to stabilize that with something solid, a piece of bone either from the patient or from a cadaver, or a piece of plastic or metal from a lab. But now we have the option to do a disc replacement, which is a device that allows that segment to continue moving. So we help our patients because we take out the part that hurts, and we help them even more by putting in a part that continues to move and helps protect the spine from breaking down as it would above a fusion.
What is the difference between spinal fusion and artificial disc replacement?
Well, fusion is when we actually take the vertebrae and we put something in between the vertebrae. Instead of an artificial disc, we're putting some device, usually a cage, and there's all sorts of cages, and we want the bone to grow from one vertebrae to the other. So what it does, it makes a solid union between the two vertebrae. When that happens, though, you make up your motion at the level above or below where you fuse them together. In contrast to an artificial disc that will continue to move, the fusion segments do not move, and it's well known that you increase the stresses biomechanically of the disc above and below a fusion in contrast to a disc replacement. The recovery is also totally different because it takes about 6 months for the fusion to heal. So while the patient is up and walking around and could go back to work for a non-laboring job even as early as 2 weeks, they can't really participate in real vigorous activities until they're fully healed.
What are the benefits of lumbar artificial disc replacement?
It usually is associated with a better outcomes, meaning that the patients are happier after the surgery, they have higher patient satisfaction. It's also associated with less surgical recovery time. In other words, there is no bracing involved. The patients can get back to their usual activities and back to their life in a quicker fashion. It's also, fortunately, also associated with lower rates of reoperation down the line, since you have less chances of having problems adjacent to where the fusion took place.
Did you know? A recent FDA study found a 96% patient satisfaction rate at 2 years following disc replacement surgery.
At the time of this recording, I'm a little over 2 years post-op, and I can tell you with 1,000% certainty that I'm completely satisfied with my decision to have lumbar disc replacement. I am pain-free and enjoying life. Can you describe how the surgery is performed?
The surgery itself is usually fairly routine, as long as you're going to a center that has a lot of experience in anterior exposures or front exposures to the spine. Why do we approach you from the front? Well, first of all, we've all heard of people who have baggage where their back was cut on and they don't feel quite the same. But you don't hear of people saying, well, my C-section still hurts or my gallbladder scar still hurts. And so if we can fix your structural problem and never cut on your back, you're not going to carry the baggage of the surgery to treat your back pain. So what we do is once you're admitted and you go off to sleep under a general anesthesia so you don't remember anything, a small incision is made on your abdomen or your belly, and we will move around your intestines. And once we do that, we are able to localize your disc. The disc then is removed, the structural problem is rectified, and then we put an artificial prosthesis in. Usually we do that with a little bit of sizing, just like you may take a certain size of a jacket or clothes and try that on. We're trying on the right size that fits you uniquely. And once that's done, the implant stays in, it's locked in. and we move on to the recovery room.
Did you know? Disc replacement tends to be a long-term fix for patients' back pain. A recent FDA trial found that 98.5% of disc patients remain narcotic-free at 5 years after surgery.
On a personal note, the first month after surgery, I felt great. But I did take a couple pain pills to help with distraction pain. And that's the pain you feel when your nerves, muscles, and joints are being stretched because the disc area has been restored back to its normal height. I probably grew a half an inch after surgery. But since then, I feel great and haven't needed to take any pain pills at all. How do I know if I'm a candidate for surgery?
Well, when we talk about artificial disc replacement, and it's not incumbent upon the individual to know whether they particularly are a candidate, they would have to go through some diagnostic measures. They'd have to meet with a specialist to try and find out what their problem is, and that's what we try to determine first. Generally, those patients have a degenerated disc segment, whether it's in their neck or their lower back. We've tried to limit the number of segments, so we're focusing on where the pain is coming from. If it's more specific or localized pain from a region of a motion segment, we can deal with that as a disc replacement alternative. If the patient has back or leg pain, or arm pain, neck and arm pain, they could be a candidate for an artificial disc. We're not talking about an artificial disc for a person who's just developed pain over the last few days or few weeks. We don't do this right away. So all patients will go through a trial of non-operative treatment and non-operative management. And when we talk about non-operative management, we usually talk about some physical therapy, alteration of lifestyle, allow the body to heal itself if it can. We use some medications, generally non-steroid anti-inflammatory medications. Sometimes we even use injections with steroids. But we give that patient a good number of months to allow their body to heal. And we work on trying to strengthen the muscles and reduce the load that the spine for that patient is experiencing. And if the patient gets better, they've avoided any type of operation. If the patient doesn't get better and they continue with those symptoms, and they do have a disc problem, which is bulging, degenerated, out of position, and somehow is producing the nerve pain or the muscle pain or the back pain, and we can localize it to, as I said, limited segments of the spine, then that person would probably be a candidate for an artificial disc replacement.
How long will the artificial disc last?
From a longevity perspective, disc replacements have been found to be extremely resilient to wear. We've implanted the first disc replacements back in 1980, so almost 40 years ago or longer. The biomechanical testing that we've done for the FDA as well has complemented these clinical findings. The disc does not start to wear out, from a mechanical perspective for at least 30 years after implantation. So most patients will have a long period of time, if ever will they ever need another disc replacement, based on the clinical and the biomechanical findings.
Did you know? Biomechanical tests have found that the latest generation artificial discs wear 16 times slower than the artificial hip.
An interesting bit of information I found out from talking with the surgeons, when they say wear of the disc, like wear and tear, W-E-A-R, they're talking about the mechanical components. At about 30 years, the wear is less than 1/10 of 1 millimeter in height. Nothing that would impact the performance of the disc. So no worries, your disc will last. Does insurance cover lumbar artificial disc replacement? When I asked the surgeons if lumbar artificial disc replacement surgery was covered by insurance, they gave amazing answers. But I wanted to break it down even further from a patient standpoint. Don't worry about insurance. Don't let that be a sticking point in you starting the process to see if you're a candidate, for 2 reasons. 1, the majority of insurance companies provide coverage for single-level lumbar disc replacement. Right now, that means about 70% of people with health insurance have positive coverage for lumbar disc replacement. And that number is growing. By the end of 2019, that number could push 80 to 90%. And 2, if your insurance company denies you, you can appeal. There are patient assistance lines that work directly with your surgeon and the insurance companies to fill out the correct paperwork to state your case. And their success rate is pretty good. So don't worry about insurance. If you have any questions, reach out to us at BackerNation and we'll point you in the right direction. Can you share a patient story?
I was treating a patient who had came into my office, came with his wife, and he was in his late 30s, just under 40, had 2 young children, came in bent over, walking with a cane, back pain and leg pain, limiting his life. He had stopped, he was an electrician, couldn't really carry on his job as an electrician. And this had been going on because he's seen 4 other providers, 4 other surgeons and non-operative people, and have had injections and therapy and medications. Wasn't getting better, and wanted to know what could be done. And I talked to him about an artificial disc. He thought about it immediately, looked at his wife, and the 2 of them agreed that that's the way to go. He came into the hospital. We did his operation. He stayed overnight because I think his operation was completed in the mid-afternoon, and I don't like to send people home in the dark. The next morning he went home. The next time I saw him in clinic was roughly 3 to 4 weeks after his surgery. He came from a distance, so I didn't see him at the 2-week mark, but I saw him at 3 to 4 weeks. And he came in, and I wasn't sure it was the same patient. He didn't have his cane. He did come in with his wife. He wasn't stooped over. He was standing up straight. He had a smile on his face. He was happy. And I said, "How are you doing?" He said, "I'm doing great." I said, "What are you doing?" He said, "Well, I've started running again." "What do you mean you started running?" He said, "Well, now I'm up to running 2 miles 4 times a week." "When did you start that?" "Oh, a week ago." So roughly 2 weeks after his artificial disc replacement, he was back to running. His lifestyle was changed. And then I asked him, "What are your plans from here?" He said, "Hey, I'm getting ready to start my electrical job again." Totally life-changing.
A recent experience is a police officer or state trooper in the state where I reside, and he had a number of opinions. One of his opinion was to do a fusion on him, and he really didn't want to have that. And through appropriate workup, we were able to identify where his structural problem was. We worked very hard to get an artificial disc approved, and obviously he has a very demanding job. At any one point in time, our first responders may be called upon to save you or rescue you, and so he has to trust his back. He has to be able to rely on that at any one point in time. So in this situation, we were able to do an artificial disc in him, and he was able to successfully return back to work as a state trooper, and he is one of the patients I remember as being one of the most grateful.
This was back in January 2007, so the patient is now over 12 years out. And this was a gentleman, very nice gentleman, but he was a debilitated chef. He was a high-end chef, but due to the severity of his back pain, they had to basically go on disability. He was taking significant amount of pain medications, and overall he felt quite depressed. After his surgery, after the Activell, within 3 months, he felt so good that he went back to work. He did wonderful, and as a matter of fact, I was hosting a dinner with my wife for surgeons, and I had hired a chef to come in and cook a meal for the surgeons. At the last minute, about 3 or 4 days before the dinner took place, the chef said, "Unfortunately, I have someone sick in my family and I have to travel." I was very concerned. I was like, it's sort of the last minute, what do I do? So I called my patient who I had operated on, and he came in and he cooked this amazing meal. We thanked him and he said, "No, thank you. You basically changed my life." He was able to go back to work full duty, not taking any medications, and just a great story.
Well, I recently got a letter from a patient that I operated on a year ago, and she sent me pictures of her skiing with her kids, hiking with her kids, and she told me, she said, I'm not really good at writing letters, and it turned out it was a beautiful letter, almost made me cry at the end, where she said, I hadn't been able to do these things for 10 years. I hadn't been able to enjoy my family. I hadn't been able to be active. And she said, I just want to thank you for giving my life back. But that's not the only story. We hear that so commonly with patients with disc replacement because they can go back and do anything they want. I have another one of a gal that was on the ski patrol, I believe it was in either South Dakota, and she had to give up her job. And after we operated on her and gave her her new artificial disc, she was back doing it. And there's so many stories, and I keep all my patient notes of things like that. That's what keeps us going. That's my greatest satisfaction, is to see a patient come back and say, Doc, I can't tell you, thank you for giving my life back.
Wow. I love hearing patient stories. I really do. I can relate to their struggles and their triumphs. And it gets me excited to know that lumbar disc replacement exists and has the potential to change the lives of so many people with chronic low back pain. I hope you were able to learn a thing or two that will be useful in your journey to overcoming back pain. If you are interested in speaking with a lumbar disc replacement surgeon to see if you are a candidate for surgery, please visit us at BackerNation.com. We have a tool that you can type in your zip code, see the surgeons in your area, and request an appointment. Until next time, fellow back pain warriors, I wish you a pain-free and productive day. Take care.
If you've been told you need a lumbar fusion, you owe it to yourself to explore artificial disc replacement. Preserve motion, prevent future surgeries, recover faster. Get back to doing the things you love. Get back to being you. Find disc replacement surgeons near you now at BackerNation.com. Back pain care starts here.